Patellar tendonitis, jumper's knee. The patellar tendon connects the kneecap to the tibia. The patella facilitates the function of the quadriceps to straighten the knee. Patellar tendonitis is often called jumper's knee. It's an overuse condition that usually occurs in sports athletes who perform repetitive jumping activities. Patellar tendonitis commonly causes pain in the inferior patella, just below the kneecap. It affects about 20% of jumping athletes. Jumper's knee can occur above the patella, below the patella, or at the tendon insertion into the tibia. The most common area for patellar tendonitis is just below the kneecap. Sports that require jumping are usually associated with patellar tendonitis. That includes basketball, volleyball, soccer. It may also occur in runners. It is a common cause of pain in the inferior patellar region. It occurs due to irritation of the tendon, and it progresses to tearing and degeneration. It is a degenerative process rather than inflammatory tendonitis, affecting about 20% of jumping athletes. Palpation below the kneecap will reproduce the patient's symptoms. X-ray could be normal. The MRI and ultrasound will show degenerative process in the tendon and tendon hypertrophy. Ultrasound with colored Doppler may show increased vascularity. Examine the patient for flexibility of the lumbar spine as well as the hamstring and quadriceps tendon. Stiffness may cause patellar tendonitis. Treatment: anti-inflammatory medication, rest, ice, physiotherapy, stretching and strengthening, activity modification. Patellar tendonitis strap. It will help to relieve the knee pain caused by patellar tendonitis. Injections. Do not inject steroids into the tendon. Could inject around the tendon. Early stages of patellar tendonitis will respond well to non-operative treatment. Needling with injection of PRP is probably a good option, but it is not proven. When the patient continues to have pain during activity and rest, conservative treatment probably will not work. If conservative treatment fails for 6 to 12 months, surgical treatment is indicated. Surgery consists of excision of the degenerated part of the tendon at the inferior part of the patella. All my videos and this video is for educational purposes only. Please consult your doctor before you make any decision about your medical care.